In this chapter, we will be looking closer at the thorax and the abdomen. When evaluating an individual for a thorax or abdomen injury, it is important to focus on the signs and symptoms, along with monitoring breathing, assessing pulse and circulation, as well as continuing assessing for shock or internal bleeding. It is very important to perform an in-depth evaluation to ensure that no life-threatening injury has occurred. The observations of a thorax and abdomen injury need to be thorough, observing for signs of breathing issues, symmetry, body position, swelling, deformities, discoloration, or protrusions. Feel for any palpable point tenderness, muscle guarding, and a pulse. Also, always take a blood pressure when evaluating an abdominal thorax injury. Assessing for symmetry of the thorax and abdomen needs to be part of the evaluation. Palpating each rib and intercostal space to assess for any palpable point tenderness needs to also occur during the evaluation. You can also perform a compression test, which is where you apply pressure posteriorly and anteriorly, as well as laterally, to check for any pain while breathing during the test. These can indicate that a contusion or a fracture to the ribs have occurred. In the abdomen, palpating is important for any tenderness or rigidity. Always be aware of the possibility of any referred pain, which can be caused by injury to other organs. Bruised ribs can be extremely painful, making them difficult to differentiate between a contusion and a fracture of the rib. Palpable point tenderness and pain with compression indicates a contusion. Pain should relieve as the compression is decreased. Pain while breathing is a good indication of a bruised rib, but not always a symptom. A more severe injury to the rib is a rib fracture. Many people think that these can only result from a direct blow, but can be caused by an aggressive muscle contraction, cough, or sneeze. Palpation of the site is helpful because you can feel a deformity with a fracture. History of previous rib fractures is critical to assess for fractures that are displaced, which can become an emergency. If a rib fracture is suspected, x-rays are required to confirm the fracture. You can brace the athletes who suffer from a fracture, but can also remain at activity if breathing is painful. A costal cartilage injury is caused by a direct blow which causes pain to the costochondral junctions. This is another injury that has similar signs and symptoms to a rib contusion or fracture. Like with any rib injury, rest is required to help heal the structure. The intercostal muscles can be strained with sudden torsion of the trunk. Pain with active trunk motions and pain with breathing, coughing, and laughing will be observed. Immediate cold application can help control the muscle spasms and hemorrhage. Compression can also relieve pain, therefore you can ACE wrap the ribs. However, while wrapping, have the athletes breathe in to allow the bandage to be able to expand with breathing and not restrict their breathing. Lung injuries are emergencies. All injuries cause decreased ability to breathe along with chest pain. There can also be a decreased level of consciousness, and you need to be continually assessing breathing and pulse. Immediate recognition is key, as all of these injuries require immediate medical attention. This image shows the different injuries in the pleural space surrounding the lungs to show how the lungs can be collapsed due to the increased air and/or blood in the pleural space. Sudden death syndrome is caused by hypertrophic cardiomyopathy or thickening of cardiac muscles in the heart. This is normally seen in individuals with Marfan syndrome. An individual can have physical presentations of Marfan syndrome by the length of their arms and legs. If these seem too long and disproportional to the body, this could indicate that a person suffers from Marfan syndrome. It is very rare to have signs prior to death. However, it can potentially be prevented by requiring EKGs, echoes, etc. during physicals. The abdominal muscles can be strained or bruised during sport. Pain, edema, ecchymosis can all be signs and symptoms of both injuries. Always rule out internal injuries, and any suspicion of an internal injury should be referred for further imaging. Conservative care is recommended for treatment, including NSAIDs, compression, ice, rests, and are all available treatments. A sports hernia or athletic pubalgia can occur at the abdominal wall due to intense abdominal stress. This can occur due to a direct blow to the groin or a strain to the abdominal muscles of the pubis. This can be conservatively treated with complete rest from activity. Some also need surgical intervention. Spleen injuries are normally concerned when an athlete is returning to sport from mono. Mono can cause an enlarged spleen, which increases the risk of rupture due to a direct blow in sports such as baseball or lacrosse, or even from a collision resulting in an elbow or a knee to the area. Treatment depends on the severity of the spleen injury. Athletes with mono have to wait at least 3 weeks post-fever before returning to activity, and if the spleen is not enlarged. If their spleen is enlarged, athletes will be out of activity for longer. Appendicitis can acutely or chronically occur due to the blockage or swelling in the area. It normally presents as a digestional pain that continues to worsen, and then a fever and vomiting will develop. McBurney's point is the area shown on the picture on the slide. Individuals will have pain localized to this area, especially on recoil from palpation. Appendicitis needs to be referred for imaging and consultation. It can be a life-threatening disease. Testicular contusion is a blunt trauma to the scrotum, which can be seen in almost every sport. This results in swelling, severe pain, intense nausea, and vomiting. Unfortunately, ice and rest with the athlete on their side and hips flexed is the only way to really decrease pain. If pain persists after 20 minutes, then the athlete needs to be referred.